COVID, flu, and RSV infections are still major public health concerns across the country.
And places providing elderly care have been getting hit hard by illnesses this year. KIMT News 3's Alec Oz is live with more about how one assisted living facility in Rochester has been managing respiratory infections. Alec.
Tyler and Jess, I'm here at Riverbend Assisted Living, where earlier I visited to learn about how residents have been getting by during a seasonal peak of respiratory illnesses. Many hospitals have had visitation limits during much of the pandemic, but care facilities like Riverbend have focused more on wearing masks and screening for COVID during times of high infections. Just like in many other assisted living homes, residents at Riverbend have been suffering from respiratory infections throughout the year. But there is now a larger cause for concern and need for precautions as these illnesses have continued to spread over the last few weeks.
We unfortunately, right before Thanksgiving, went into a huge outbreak where probably half of our facility had COVID. So we decided to implement putting the masks back on probably beginning to mid-November when that occurred. And actually this morning we decided as a management team that we're no longer in outbreak. Our last person came off of COVID isolation last week.
Morgan also shared that Riverbend Assisted Living determines its masking policies based on community transmission rates. Live in Rochester, Alec Oz, KIMT News 3.
All right, thank you, Alec.
And while there was a high rate of infection, there were no fatalities at Riverbend from the recent COVID outbreak.